Welcome to the Reinventing the White Coat podcast, where we delve into conversations aimed at helping you foster a healthy relationship with your career and yourself. If you're a physician feeling unfulfilled or burned out or want to prevent yourself from going down that path, then this podcast is for you. I'm your host, Jennifer Shaer, pediatrician, chief wellness officer, and executive and life coach. Sit back and relax as we explore ways to live your best life and have a career in medicine. Okay, so today I am thrilled to welcome Dr. Paul DeChant to speak with us about physician burnout. And Paul, it's like my enthusiasm. I can't control it. I'm so excited. So thank you.
Oh, thank you for having me. I'm very much looking forward to this.
Great. So as a way of introduction, Paul is principal and co-founder of Organizational Wellbeing Solutions. He's a speaker, author, executive coach, and healthcare advisor. All of this built on a foundation of a 25-year, hugely successful career as a practicing family medicine physician. Paul, honestly, I can't think of a better guest to help me kick off this podcast. Thank you really so much for being here.
Oh, Jen, it's my pleasure. I value every opportunity to connect with people and share with them the messages that I've found make a difference in helping really get to the heart of the problems that we're facing in medicine today.
Yeah. And, I don't know, I can't remember where I found your book. I'm going to just show everybody if you're not watching, and just your book called Preventing Physician Burnout, Curing the Chaos and Returning Joy to the Practice of Medicine. I don't know how I found it, but as I was reading through it and highlighting and going through it, I was like, oh my God, this guy totally gets it. And I think I reached out to you on LinkedIn and you just so kindly, responded. So why don't we start by having you just sort of tell us briefly about yourself and your journey and start with that.
Sure. Great. Thank you. I never could remember a time I didn't want to be a doctor. And even pre-med, I worked as an OR orderly, mopping floors and transporting patients and things like that. But when I started practicing family medicine, I realized pretty quickly that there were days things didn't go well in my office, and I would speak up about those to try to fix them. And in that process, then gradually started doing more leadership and management work along with the clinical work. Really driven by the desire to make things better rather than have some position of power. And over time, I practiced for 25 years with gradually increasing management roles in a variety of healthcare organizations. I did a year of small town ER in Colorado. I did my residency in Colorado, did a year of small town ER work there. Spent 9 years with the Palo Alto Medical Clinic in the San Francisco Bay Area, starting up a satellite office and leading it to a certain degree. Actually, during that time, I kind of burned out. We were growing so rapidly and there was so much pressure on us that I found when I was the medical director of that office, I would close my door during lunch just so people wouldn't bother me anymore. And I knew there was something wrong there when that started happening. And in fact, I handed off, one of the lessons I learned was to hand off some responsibility. And we'd hired a great doc who was very interested in being medical director of that office. And I was ready to do some other things, which I did in the community. And we had a great transition that worked out really well. So there are ways to cope with different challenges that we run into along the course of our careers. I followed that 9 years with an opportunity that came out of the blue to practice in Breckenridge, Colorado, the ski resort, small town. I was a small town family doctor, really connecting with everyone in the community, as well as the ER doc at the base of the ski hill. I kind of called it my Marcus Welby and Trapper John career. It was, and that was a great experience. During that time, also ended up continuing my management roles and merged 5 small groups together into a group of about 30 providers. Got my MBA during that time, and then got an opportunity to work at Geisinger in North Central Pennsylvania, and was a department chair there, turned around a department that had been a bit struggling, and became the lead for the primary care division, which had at that time about 200 doctors in it, for both the compensation committee, which, as you know, can be a real challenge, and the Epic optimization committee. This was back in the early 2000s. Epic had just been introduced. None of us really knew how to handle this monster, and there wasn't anybody else starting up this committee. I thought, we need this, so I started that up as well. From there, I went back to Palo Alto. They asked me to help start up new offices for them in contiguous geographic areas. So we started up some offices there and really designed them around some lean principles to make things more efficient for the docs and the nurses, to be able to, not have to walk so far, to know where each other was throughout the course of the day. And to actually, this building was fantastic. It had floor to ceiling windows all around the perimeter, and we were able to put the docs and nurses cubicles and offices out there, so they got the benefit of all that natural light when they weren't in the room seeing patients, which was, I think, a real added benefit. People truly appreciated that. There, I also was involved in merging three large groups together under the umbrella of the Palo Alto Medical Foundation to create an 800 physician group. This was back 2008, 2009. And then I became CEO of a 300 physician group in the Central Valley of California, and realized that as CEO, finally had the opportunity to truly lead change and make significant improvements for all of the docs in the group, so that we were, able to do things that we'd all wanted to do, be able to focus more of our time on patient care and things that were meaningful, less of our time on what I call administrivia, typing data into the EHR, fighting with insurance companies about prior auth, chasing all over the clinic, trying to find the equipment you needed, all those kind of things. They were all problems we could solve if we worked together to do that. And so we came together, really changed our management system, our culture, and the way that we improved processes, and had great success doing that. At the end of that time, at the end of the 5 years I was CEO, we got recognized as the top performing group among 170 groups across the state of California 2 years in a row by Consumer Reports. And our physician satisfaction went from the 45th up to the 87th percentile on AMGA's survey.
Wow.
I realized, really looking back, I realized a part of what happened was that as a practicing family doctor, I wanted the autonomy to fix things that went wrong in my office. Yet when I became CEO, and as most of us, when we're in our clinical roles, we look at the leaders and we wonder what is wrong with these people, that they don't understand the challenges we've got, and they just come at us with these mandates to do this, that, or the other thing. But as CEO, I suddenly was faced with the fear of 300 physicians all autonomously, independently solving their problems the way they thought they needed. And I worried we'd fall apart from entropy. Because unless we were really united and somehow connected and working together, and we managed to find that way with a management system approach that gave people autonomy and aligned us all around enterprise-wide success. And that was really key, because we're brilliant, as clinicians, we're brilliant knowledge workers. We need that autonomy to solve problems and to make things work well. And we deserve it. We worked hard.
Do you think people were more responsive to you as CEO because you were a physician?
I don't think it was because I was a physician. I think it was because they were treated with respect and understanding. Mm-hmm. And I think there are more physician CEOs that are able to do that, or clinician nursing as well. But I also have seen both non-clinical CEOs who completely get it and lead well, and clinical CEOs who don't get it and revert to that top-down command and control management. So yeah, it's more a mindset, and there's more of that mindset in clinicians, but it's not absolute.
Yeah, I get. Wow, you've said so many. First of all, your journey is fascinating, and there's so many things that you mentioned that I'd like to sort of tap it, dig a little bit more into, from the lean, so many things. But maybe if you could take a step back for a second and speak for a moment. There's a little bit of a debate and almost like anger between the people who talk about burnout versus the people who talk about moral injury. and it's a little bit heated. And I thought maybe who better than to speak to what that's about.
Well, I'm certainly one voice that can add to the conversation. I don't know if I'm the best, but it's a really important issue because there's no question there is moral injury, and in my mind, there's more to burnout than simply moral injury. It might depend somewhat on just how broadly you define moral injury, but moral injury is defined as someone who's experiencing either witnessing a violation of their personal values or having to participate and experience participate in violation of their moral of their values. That's at the core of moral injury. And we see it play out in many different ways in healthcare. And you may be familiar with the work of Wendy Dean and Simon Talbot and the book that they've recently come out with. And that certainly describes many different ways that moral injury is experienced by clinicians, and it's serious. And I've been through experiences like that myself, both as a clinician and as an administrator. I really some very difficult personal choices I made that damaged my career in some ways because I really felt the need to maintain values around a certain aspect of care or leadership. But there's, and it's definitely, in some ways you can even think of it as a sinister force in healthcare these days. But there's more to it. One of the great pleasures I've had is to get to know Christina Maslach, who created the Maslach Burnout Inventory. And in her seminal work with Michael Leiter on burnout, they've described the 3 dimensions of burnout, which are exhaustion and cynicism and that sense of inefficacy. They also identified what they see as 6 key drivers of burnout that they describe as job person mismatches. The first is work overload, and they've demonstrated that actually drives the exhaustion dimension of burnout. But the other 5 drivers, which are a lack of control. It's a big deal. Autonomy is a big deal to us as physicians, as it should be. People want us to take control in key situations. Insufficient reward and recognition, just appreciation. And that comes in so many ways. Most physicians are not suffering from financial reward challenge, but just the being honored as the professionals we are, being respected for that. Within an organization, as medical corporations become more complex, oftentimes feeling like we're not being respected and appreciated. Breakdown of community is the next. And we see that in so many ways. Even pre-pandemic, physicians were gravitating either to the office or to the hospital in many cases, or even if we're on a team together in one location, in a room together, we may be interacting directly, not with each other, but with our technology far more than with each other. The next a driver that they identified was absence of fairness, which I think happens in 2 ways. One is a macro way. The job we signed up for when we joined this profession and committed to, essentially give up the decade of our 20s to getting the knowledge and skills we needed rather than being out starting our families and partying or whatever our contemporaries are doing in their 20s. We did that with this kind of a societal compact that as physicians we would gain certain respect, certain opportunities, and we're seeing those dissipate.
A little bait and switch, huh?
Yeah, exactly. And then, but the other absence of fairness happens more in a micro way, in everyday things, where people aren't being treated based on the quality of their performance and what they're contributing to the organization, but based on things they have no control over, like gender, race, country of origin, sexual orientation, favoritism that's applied based on something other than the quality of work people are doing. And especially these days, as the clinical workforce is changing so significantly demographically, the DEI work becomes so important. And then lastly is conflicting values, which is where the heart of moral injury lies.
Right.
And it's that, witnessing or participating in things that violate your personal values. So it's, and those 5 drivers, the control, reward, community fairness and values, those drive that cynicism dimension and have all to do with how someone leads. Whether you're leading a team as small as 2 or 3 people in your little pod, or if you're leading a health system with 20 or 30,000 employees, how you approach and are aware of and deal with those 5 drivers has everything to do with whether the organization is one that feels very top-down, command and control, and disempowering, or one that empowers everybody working in the organization, aligns them, and really creates great engagement.
Right. And it's different whether you're on that organizational side or you're the individual. But the value piece, it's interesting because I think about my own sort of journey, and I think about, none of us are strangers to hard work, right? And exhaustion. And that's all well and good when you're sort of connected with your purpose and your values. But when that goes off, then it really, then that's the difference between like exhausted and sort of like from a great hard day's work, as opposed to completely, conflicted. And I just want to share for a second a personal experience that I had when I was in med school. I think, they didn't call it, nobody knew what moral injury was back then, but, we work hard in med school. And I remember the physiology lab we had to do. Did you have to do the dog lab when you were in physiology, where they put all these dogs, and you have to like push Lasix and practice chest tubes and all these things. And at the end, they euthanize the dogs, throw them all in garbage bags, and goodbye, And I was like, I thought I was a pretty good student, but I was just, I couldn't do it. I went to my physiology professor, and he was like the nicest, most soft-spoken guy. And I went to him and I said, listen, is there any other way I can learn this content? I don't think I can do this dog lab. I really was torn up about it. And he said to me very, very calmly, he said, well, if you don't think you can do this, then maybe you should rethink your career. And here I was like devastated and traumatized. I ended up doing it because I didn't want to not be a doctor, and it was awful. And come on, I could have learned what Lasix does without having to use right? So I think, does that is that like an example you think of?
Oh, very much so. On a personal level, violating your value, being forced to do something that violated your values, that's the definition of it right there, for sure.
Right.
Yeah.
Yeah. So how did you get through on your personal level? It sounds like you've sort of teetered on some episodes of burnout and incidents, but you managed to take those up, really each time you like go to a new level, a new, what advice do you have for people? How have you done this so well? And then we're going to get into some of the institutional things that you talked about.
Yeah. When I think about for myself, particularly going through it, I don't know if I've done it all that well. When I was early in my career, I was medical director of a satellite office for the Palliative Medical Foundation. And did I tell you all this already? We were growing rapidly. And I actually found myself, I was burning out. I was closing the door to my office during lunch so nobody would come and bother me with anything.
Yes, you did say that. Yes,
so I had to hand it off. I think that part of it's being connected to purpose. The thing that's driven me is knowing that things can be better and not accepting them as they are. Now, there's been some pretty deep, dark moments in that, because oftentimes we are fighting against some pretty well-established issue, well-established forces. What we're advocating is change, and change is great for the people that feel like they're suffering. For the people that are doing well in the current system, change is not a good thing. In fact,
speak about that a little bit more.
Yeah, one of the quotes, I haven't used it in a while, but I think, and I need to bring it back into my presentations, particularly with leaders. is what I describe him as one of my favorite management consultants was a Niccolo Machiavelli, the Renaissance philosopher, who and it was a statesman. And people think of Machiavellian as you're pursuing your self-interest, irrespective of others' concerns. But he was pretty wise, and one of the statements he had was that one of the most dangerous things to do is to undertake change to the natural order of things, because when you do that, you'll be the people who you threaten by changing, who have the advantage currently and who will feel threatened by that change, will fight you tooth and nail, and, really vociferously. And the people who would benefit from that change will want to support, but they're less likely to support you as strongly as the people that are trying to defeat you. And in part, it's because they are intimidated by the forces that are trying to resist change. And we see that all. I mean, I've certainly seen it a lot in my career. And the people who will benefit from the change haven't personally experienced the benefit yet. So it also decreases the intensity with which they support you. And in fact, it's one of the things I think that when we're leading change, a real value is to be able to make a site visit to some place that's already doing the thing that you're advocating for as a change agent, because it lets people see what we're talking about, help them experience it. And once they experience it, that can often be a seminal moment in helping them become strong advocates for the change. And nobody can lead change alone. You need strong advocates around you, and you have to build that team in order to get there. And they need to understand that to really be good teammates.
How do you think that doctors who are looking for jobs can sort of get a sense as to the culture of the group or the organization that they are looking at, as to the health of the culture, and find the right place?
Yeah. So that's a really important question these days. And it's, well, there's a number of things. First of all, you should ask if you can just meet with some of the people that would be your colleagues without anyone in management around. And just actually, have lunch or dinner or some time that's a slightly unstructured, less, more than just 5 or 10 minutes to sit and talk about what it's like to work there with the people who are working there, with people that are going to be your teammates. You'll probably learn more from that than almost anything else. Secondly, ask the leadership what they're, whoever it is that you're interacting with from the recruiting team, what is the commitment the organization has to clinician well-being, and what activities do they, specifically are happening as a result of that. And then there's a number of other questions you could start to ask, like sort of almost behaviorally oriented questions, which are commonly asked of candidates when they're being interviewed. Now, present a situation and ask how someone would react, but actually just turn the tables and say, okay, what would happen if I find that I'm really struggling, it feels like the expectations for productivity are greater than I'm feeling I'm able to achieve, either because I'm lacking support staff or some other issue. How does leadership address that here? And what has been your experience with physicians addressing that? Something like that, that's really going to, hopefully whoever's being asked that question will stop and think a minute, and then respond in a way that you can evaluate as to whether that's a place you feel like you could work.
Great. I think that'll be really helpful for people. The other thing is, that you talk about being connected with purpose and also having control. And people get so, clinicians get so frustrated with the inefficiencies that we're dealing with every day. And you speak so much about lean done right in your book. And I thought maybe you could explain a little bit about that concept and how clinicians could potentially advocate for that to be brought to their places of work.
Yeah, no, I appreciate that question, because lean can be a real hot button.
Mm-hmm.
There, whether, and oftentimes people have had a bad experience with what somebody described as lean in their past. And so it's something that's can be a real burden to overcome. And in some ways now I'm not using that word, the lean, as much, just because it carries so much weight. People automatically turn things off before they have a chance to hear what we're talking
And
about.
for those who don't know what it is at all, maybe just briefly.
Sure. First of all, it's not an acronym. It's not spelled with all capital letters. Lean was a word that came up as American managers and consultants were learning what Toyota and other companies in Japan had done post World War II and achieved great success in manufacturing without very many resources at all. They realized that the word they used to describe it was that these companies were running very lean. The reality after World War II, Toyota was trying to launch its manufacturing business. The country had been devastated. There's very little equipment, very little resource, very little money. What they had were people, and they had to learn how to maximize the potential of their people in order to solve problems, to make their products better. And that's what gets lost often in lean. People think a lean expert's going to come in, they're an efficiency expert, they're going to tell me how to do my job differently so that I can be more efficient. And oftentimes the undercurrent there is I can be more productive, and do more with less, and think, work harder, work smarter, not harder. All those things that, and a core can be right, but they have to be done with the correct attitude. Lean done right there's two principles in lean. One is the continuous improvement, where we remove waste by identifying all the steps involved in a process, figuring out what's not necessary, and figuring out a new way to do the job without that unnecessary work in there. But it happens effectively because of the first principle of lean, which is respect for people. When we recognize, and this comes that whole concept really transcends just the lean community. One of the most famous management consultants of all time was Peter Drucker. And he described, not only to say that healthcare was one of the most difficult, complex, and chaotic industries to manage. So, having some empathy for people in leadership roles, but that really what we are knowledge workers, and knowledge workers are people who have to innovate all day long and know more about their manager does about the work that they do. And so they need the freedom and autonomy to do their work well. And what we find, and that's certainly what I felt as a family physician practicing for 25 years. I wanted the autonomy to fix things when they went wrong in my office. That's really the only reason I got into management in the first place. But when I became CEO of this 300 physician group, and the thought of 300 people all, doing it independently, the temptation, at that time, it was 2009, it was the depths of the Great Recession. We had a negative 3% margin, a $9 million deficit in a $300 million organization. The pressure from my superiors to perform and hit every target that they had set for performance metrics. The temptation was to go into top-down command and control management and just tell people what to do. But I knew it wouldn't work. And that's where we found this way instead, with respect for people, to say, okay, you guys know what your challenges are. You know what's wrong. You have good ideas about how to fix them. Let's provide a mechanism by which, a formal process by which you can actually do that, identify the problems and test your solutions. And that's how lean done right is done. It's not somebody coming in telling people how to do things differently. It's the lean consultant comes in assisting in that process so that the process isn't done in a way that's wasteful, that, we've got a job to do. We don't need to learn how to do that redesign process. What we need to learn how to do, we need to coach to do the redesign process efficiently so we can create our own process that will be efficient.
Yeah. And to hope that the people on the ground, right, the people who are in the offices, the frontline people, aren't so burned out and disengaged that they've given up on trying to make improvements, right? I mean,
absolutely. And part of it also comes from the concept that I like to think of this, ask this question: who's the most important person in a healthcare organization? Because if you don't answer the patient, you're not answering correctly. Without a patient, the organization has no reason to exist. Our jobs wouldn't exist without patients. So patient's clearly the most important person, and the most important thing happening is a healing interaction for that patient, whether it's with a doctor, a nurse, a receptionist, a technician, anybody who's interacting with the patient has a chance to reduce anxiety or worry, relieve pain or suffering, do a procedure that makes them better, educates them to be healthier. Practicing clinicians and frontline, anybody interacting with the patient has that opportunity. When I became CEO, after 25 years practicing family medicine, 100,000 healing interactions, I was no longer a CEO dealing directly with patients. I wasn't doing the most important thing in my organization. And so the role becomes one to make sure that the people who are on those front lines have what they need so they can do their job well. And whether that's as a manager, a director, or somebody running one of the support services, which are there to support the front lines, HR, finance, IT, compliance, you name it. Those roles are about supporting that work so it's done well. And when we all have that attitude, then we can really make a difference. And it's that respect for people and the work that's being done, then aligned with continuously improving how the work is done, that makes a difference.
Yeah. So many people are leaving medicine because they just can't take it. And it's nice to hear your perspective. And I wonder where do you have hope? Where do you have hope for the future of healthcare?
There are organizations that do understand this, that are pursuing it appropriately. And finding those organizations where the leadership is very vocal about that respect, not just lip service respect, but actually vocal about it. Those are the organizations that will make a difference. Yeah. I think the other hope I have is, there's many people who are familiar with the quote, clinician well-being community recognize the Stanford WellMD model with the 3 components of professional fulfillment: personal resilience, practice efficiency, and culture of wellness. Personal resilience, there's been tremendous effort put into that. I don't actually focus on that much because so many people are doing such good work in it. Practice efficiency is all about our ability to reduce that work overload and thereby reduce that exhaustion. And we do that by intentionally redesigning workflows. And if we do it well nowadays, particularly if we can combine intentional redesign of workflows with the technology opportunities that are coming out with AI and other technology, we have an opportunity, what I like to call flip the ratio. We spend 1/3 of our time in meaningful work, 2/3 of our time on administrative waste. Imagine if we just flip that ratio, what the potential would be.
Oh, that's definitely hopeful.
Yeah. Well, think about what it means for access, for work-life balance, for quality, for safety, for just the financial capacity for an organization to support their clinicians and their patients better. To achieve that, then we have to look at the culture of wellness section, because there's 2 components, I think, to that. One is just this concept that we all treat each other with respect. The other is the actual management system design and processes that enable that. And it's connecting that commitment from leadership with those processes that enable that ability to redesign work that can help us achieve that practice efficiency. But, as a clinician, when you look at those 3 components, most clinicians are going to care about practice efficiency. If we solve practice efficiency, we wouldn't need so much resilience support. And as a doctor, do I care about an organization's mission, vision, and values? They're my personal values, yeah. But as long as I'm able to honor my personal values, the organization can tack whatever they want to on the wall around those statements. If they're done from that standpoint, they can be incredibly important if they're honored properly and used as the way to lead. I'm not meaning to diminish them. I think there's an amazing value that's untapped there. But as a doctor or a nurse, or even people working on the reception, et cetera, we want to just be able to do our job and take care of patients. Let's get that efficiency. And we need to get leaders who understand that, who support that, and bring to play the resources needed to create that efficiency. And that's where the organizations that do that, they're going to be the winners in the long run.
Yeah. All right. And I do hope that because I know a lot of people are nervous about AI. There's a part of me that feels, who knows what's going to happen? Nobody knows what the future is going to bring, but I am hoping that it's going to bring us some efficiencies and allow us actually to have a little bit more of what we want, that direct contact and closeness with the patients. Yeah, for sure.
Sure. Well, you're absolutely right. It has to be done right. When we brought in the EHR, we just basically dumped it on top of a paper workflow process, and it was a disaster because of that. We didn't thoughtfully incorporate what the EHR could bring. Same thing could happen with AI. However, if AI can help reduce the burden of managing an in-basket, because it routes almost, any message that we don't truly need to see, it's being managed some other way due to a combination of AI and workflow redesign, that frees up things amazingly for us. It's the intent with which it's used. But I think the other point about AI is the world around us, our environment is going to continuously change. And the ability for us individually and our organizations to adapt to that change is really the key. So, as an individual, being aware of what's going on around you, and being able to connect with your colleagues around how best to adapt to those changes, which we did during COVID in amazing ways. And the ability of an organization to muster its resources to support that adaptation are the things that are going to determine long-term success, and whether things like, if we can adapt to change rapidly, we'll be successful. That was Darwin's message about evolution, right? The survival of a species. Doesn't matter how big or strong you are. Didn't matter what your financial bottom line was or what your geographic market share was. What matters is your ability to adapt to change to succeed in the long run.
And it's coming faster and faster.
Indeed.
Listen, Paul, I could talk to you all day. This is so wonderful. I wonder if you have any last minute advice for people just starting out?
Just starting out. First of all, don't go into this if you don't love it. Basically, I think if you can't think of anything else to do that would be as meaningful and valuable for you, then you're in the right place. If you're thinking you could do just as well in some other field, go to that other field, because it's too hard otherwise. It's also so rewarding that it's worth it if it's in your blood. If it's your purpose, if it's your mission, it's worth it.
Yes. The new doctors are not going to have a bait and switch because they know what they're getting in for. They're going in.
Hopefully the opposite bait and switch. They'll think it's so bad, and then we can make it, I don't know, I get too optimistic sometimes. We make it better.
Oh my goodness.
They're expected.
All right. So Paul, where can people find you if they want to connect with you?
Oh, well, thanks. So I have a website, www.pauldechantmd.com. And you can certainly connect with me there. You can email me directly at paul@pauldechantmd.com. And I've actually just recently formed a new small consulting group with a partner, Bruce Cummings, who's a retired hospital CEO. And together as a physician and a CEO, we're working to help bring these ideas forward, particularly to leadership. That organization is called Organizational Wellbeing Solutions, with the concept being that we're really wanting to focus on making the organization healthy and effective. And that way, everybody working in it can experience the benefits of that.
That's where I want to work. For sure. All right. Thank you so much for joining me. It was truly a pleasure.
Thank you for having me. I really appreciate the opportunity. First of all, just to spend time with you. It's a delight. And secondly, to share these ideas as broadly as possible.
Yeah, we'll keep the optimism. We have to, right?
There you go. Thanks.
That's all for this episode of Reinventing the White Coat. If you enjoyed this conversation, subscribe now so you don't miss an episode. If you're interested in coaching or in being a guest on the podcast, you can reach out to me online at shaercoaching.com. Thanks for listening, and don't be afraid to live your best life.